Joining us now is Bill Caruso, a Democrat strategist and attorney at law, and Melanie Collette is a policy analyst for the Committee for a Constructive Tomorrow and host of Money Talk with Melanie. Welcome, guys.
Good morning.
Good morning.
Great to have you. So on Capitol Hill today, senators on the HELP Committee are holding a hearing called Making Healthcare Affordable Again. They're going to be grilling experts on why families are still getting crushed by premiums, deductibles, and sky-high drug costs. But at the same time, President Trump talked about his executive order slashing drug prices. Here's how he described it at yesterday's cabinet meeting.
Under my executive order to lower prescription drug prices, which I think is the single biggest thing we've ever done that nobody writes about, to slash drug prices by 200%, 300%, 400%, 500%, 600%, 700%, 800%. Nobody's ever heard of it before.
So Democrats are saying prices are still too high and that Trump's deals only benefit a small slice of patients, while Republicans on the HELP Committee are debating whether to extend the ACA subsidies or let them expire. So, Melanie, is drug pricing and Trump's strategy actually working for everyday Americans?
I think it is working for everyday Americans, and I think the assertion that it's only working for a few, this is always the narrative on Democrats. It's always some kind from Democrats and the left. It's always some kind of criticism and not an actual idea behind the government, besides the government throwing more money behind it, which inflates the price. It's a very, very general economic principle that that's what happens. And so if you want to know why the ACA it will suffer a 114% hike in the cost, it's because the government keeps subsidizing it the way it does, and the only people who are getting richer are the insurance companies.
Interesting. Well, President Trump is not just focused on, let's say, everything that you buy in the grocery store, gasoline prices, home heating oil #2. He's going down the list. And billionaires Michael and Susan Dell are pledging a historic $6.25 billion to provide an incentive to families to adopt new investment accounts for children under the Trump's plan. Take a listen.
The Dells are announcing today that they are giving 25 million American children $250 each to save and to invest in their personal Trump account.
We believe that when children have a future that they can see is worth saving for, then that will help build hope and opportunity and prosperity for generations to come. So we're so excited to be doing this and hope to have many people join in our efforts.
Now, Bill, this comes as part of President Trump's tax and spending legislation. Can you just walk us through, from your perspective, how this will actually work and benefit everyday Americans? Because a lot of people on the left, right, and center actually embrace this idea for so many reasons, including the fact that it's public-private partnership bringing savings and an opportunity in the future for everyday working Americans. What say you?
I love it, and I think we should encourage this, but unfortunately, my friend, I cannot explain it to you because we don't have all the details. But I'm not going to throw rocks at this. I think this is a great initiative. We see the private part coming. I'd like to understand better what the public part's going to be. This is, and by the way, I like that it's means tested. I don't know that my family and other folks need all this right now. By the way, I don't have any kids this age any longer in my life. But I think this is really smart, and it's a good thing. But I want to go back to what Melanie just talked about. The devil's in the details on healthcare, on costs. But it's not about what the president says. It's about what Americans are feeling. And, we've been waiting since the last Trump presidency for a healthcare plan coming out of this administration. I'm happy to hear that the folks on Capitol Hill are going to be working on something today. They shouldn't just rely on the administration to do this. This should be something led by Congress, too. But healthcare is too damn high right now. The costs are too damn high. And people know this. They're feeling it. And so what we need to do, and 100% agree with Melanie on this, we're not going to pump more money into the insurance system. That's not the solution. The solution is to bring down the cost on the healthcare side, on the provider side, on the drug cost side, and to cut out some of the fat on the insurance side and make sure that the American public are realizing those benefits. We have the greatest healthcare system in the world, but I guarantee you if you polled Americans, they don't feel that way.
Yeah, there's problems with ACA, but you know what? Let's go back to what Barack Obama said.
Let's just blame ACA.